With patient care, one of the things that drew me to that aspect of oncology is how well you get to know patients and how well you get to know their families. And it's more than just giving them chemotherapy or giving them radiation. It really, you become part of their life. And there's so many psychosocial issues that are tied to a diagnosis of cancer that you feel very honored to be that closely linked with patients and really get to be part of their life.
I was in the middle of my chemo treatment and we went to a hospice gala and Dr. Crews happened to be sitting at our table. I wasn't very chatty because I didn't feel very well, and I went out and got my coat. So she came out and she gave me a big hug and she just said, "I want you to know, when you're ready to transition, here's my card. I want you to call me and I want to be your doctor." She's very compassionate. And one thing I really like about her is she makes you feel like she could be your friend outside of these walls.
She is always seeking what's best for patients, and she does that clinically, and she does that emotionally, and she does that spiritually, and it's just, she's extraordinary.
It's important to realize that 2 of our cancer centers, the one in Ketchikan and the one on San Juan Island, are only accessible by air or by water, which poses a lot of challenges for the patients who are there. And it's certainly not easy for them to leave their communities and come to a cancer center like the one here in Bellingham.
I see firsthand the many times she travels to Ketchikan, to San Juan, because she so strongly believes that the best care is care given closest to home.
How can we provide care without geographic boundaries? How can we as providers, whether we're at United or at St. Joe's or in Ketchikan or at Friday Harbor, care for all of those patients with the same standards and the same high outcomes?
And she has so many contributions she's made to so many communities, and she's touched so many lives, patients, caregivers, the community at large, the community at small. She's just made such an enormous difference. We owe her a debt.
You know, cancer care really is a multidisciplinary team. It's made up of physicians, nurses, dietitians, social workers, and it's important that we all work together to provide the best care for the patient. Delivering cancer services is highly dependent on collaboration, and I couldn't have done it without all these people.